you're all three places too, but yeah, it does work here.
Hey, Jonas, let me interrupt. Wendy Muzzy just dialed in, and she works with Rep Schrier. So I'm guessing Rep Schrier should be here shortly.
She's here.
Just arrived. Hello, everybody.
Welcome.
Good morning.
Well, thank you for having me. I love joining with Rotary meetings. Am I interrupting? Did you finish up whatever you were talking about?
It's never important.
Are you kidding? Service is always important.
Yes.
Having smiles. Do you guys do the smile thing? Smiles are always important. Ending polio is always important. So thank you for having me today.
Thank you.
Yeah, you're welcome. I was the, for the Chamber of Commerce, and you had done a video during this last election for us, and that was fantastic. So I've kind of met you a couple of times just through the chamber stuff, and thank you for coming to our little Rotary. But we're small but powerful. We got a lot of great people here, and you know, I would go ahead and hi Wendy. I've seen your name in emails, and but I don't think I've seen you before. So welcome, and we're all ears. Want to hear about what's going on, and maybe we have some questions if that's all right.
Yeah, I think that's great. Questions are actually my favorite, because what I really want to talk about is what you all want to know about. And so I just put myself on gallery so I can see all of your faces. You know, I'll give you just a couple introductory comments and then take questions. I'm delighted to be back as your representative in Washington, D.C., and excited to, you know, hopefully show how when government works well, we can deliver. And hopefully the first evidence of that will be this big COVID package that we are working on right now. We are working with haste, working with both parties to try to get through a package that will have relief for small businesses. It will have relief for families in the form of checks to help families who are at low to medium family incomes. It will have resources to open schools safely, because we know that schools can be safe places if they have good ventilation, masks, separation, and the like, but not all schools have that. And so let's get our kids back in the classroom. And as a result, let's get parents back to work, in particular women who have in many cases really been the ones who have borne the brunt of this and left their jobs. This has money for vaccine rollout. We've got these great vaccines, 95% effective, being rolled out as we speak. More like the Johnson & Johnson, the AstraZeneca will probably be approved in upcoming weeks and will come with millions more doses. But we're running into these hiccups in rolling them out, getting them into people's arms. And so the funding that we put in this bill will hopefully smooth that process. We need national databases. You know, if you want to have, you know, at some point a requirement to get on a plane, to travel abroad, to, you know, maybe some workplaces, you can't count on the little card that you get when you get vaccinated, like the little yellow one when I was growing up. You've got to have databases. We have one in Washington State. Most states have a computer database so that any doc you see in that state will be able to see all your immunizations, but those databases can't talk, and we need them to. We need to have some national system to be able to tap in wherever it is that you reside. So we've got a lot to roll out. I mean, even how do you schedule appointments if you don't know how many doses you're going to have in the next few weeks? So things are already improving with 3 weeks notice to states about how many doses they'll get. That helps a ton. But I'll tell you, I just had to get my parents scheduled for vaccines, and it's quite a process. So we're looking to make all those things easier and to do it quickly, and to show that when government is not obstructed, we can really do great things.
Ask a question?
Of course. So the floor is yours.
Yeah. So, well, I'm generally very happy with, you know, seeing what's going on with the new administration, also with most of what the Washington state is doing. One thing on the news was kind of alarming to me, that the state of Washington, at least, kind of reprimanded health providers which were reserving doses for a second vaccine. And they said, no, don't do that. Give the first one to as many people as possible. And that like completely didn't make sense to me. And I was wondering what's being done on that front on the federal level. Because I think, yeah, if you got the first one, the first priority should be reserving the second shot for those people.
Right.
So I think that's a great question. And first, I just have to ask, I'm going to show off, well, maybe not show off. Nir, does that mean thunder or lightning? Or am I totally wrong?
You are totally wrong.
Okay, so what does Nir mean?
Well, it's a name in Hebrew, and it has several meanings. Like it could mean a green field. It also means happiness.
I was super far off. Okay, that was my 25 years ago trying to remember. Okay, so, you know, the question you're asking is really important. And there's debate about which way to go is smarter, right? These vaccines were tested as 2 doses for Pfizer, 4 weeks apart, for Moderna, 3 weeks apart. And you really, if you want to go science, you got to follow what they did. Now, on the other hand, we've got these different variants coming in. We know that even after 1 dose, your risk of death goes way down. You could still get it, but it becomes a not deadly disease. So there's really the crux of the question is do we go for the maximum number of people and at least get 1 dose in, or do we hold back some doses and get, you know, perfect protection for half as many people? And different countries have decided different things. I think what's pressuring the decision now is that as we see variants show up, you know, the way that you probably don't know, I mean, the way that new variants appear is when they spread from person to person. So every time they spread, there's a chance that there will be a mutation. These mRNA viruses, they mutate a lot. So we don't know if the next mutation is going to be like a really disastrous one, if it's going to be a big nothing, but they're changing all the time. And so we're really racing against the clock. And so I think what's happening is this sense that no vial should be on the shelf, more will be coming. If it ends up being 5 weeks instead of 4 till you get your next dose, okay. You know, with other vaccines in the pediatrics office, with every other one, if it's late, it's still effective. And, you know, I think we got to get them all out there and at least make a dent, even if it's not perfect protection. I hope that answers the question.
My concern is that, yeah, my concern is that, you know, if people don't get their second shot, we push ourselves into unknown territory because, you know, how effective are they over time with just a single shot? Do you need to take both shots again? Like, what's going on? We're going to be in a mess.
Yeah, you wouldn't have to.
It's unexplored.
Yeah, you wouldn't have to restart the series. You know, nowhere in my history of pediatrics do you have to restart a series. And we got information just yesterday that the AstraZeneca vaccine, I believe, is 75% effective even after the first dose. So we're getting more and more evidence that you get at least enough protection to say, okay, you might get COVID, but you'll get COVID that keeps you at home and that won't land you in the hospital or kill you. And, you know, that basically takes it from the super scary disease that it is right now to a much less scary disease, particularly for high-risk groups. So, I mean, it's a debate, and, you know, I'm giving you the perspective that is currently kind of being swayed towards. Who's next?
Thank you.
So I just thought I might relate my own personal experience with this. I got my first COVID shot, Moderna, last week, but boy, what a circus. First, I got an email from Overlake Hospital telling me that I qualified to get a shot because of my age group. And they gave me a link, and I followed the link, and that gave me a list of available dates. And I'm scrolling through all of them, and they all say already booked, all the way down for a month out. Then I got another invitation from Swedish Hospital because I'd had some work done there. And they gave me a link, and I followed that link, and it took me to a different calendar that had available slots for the next, I think it was 1 week. Oh, but those were already booked up too. So I thought that was weird. And then my wife said, well, she'd seen something on Facebook that the Snoqualmie Valley Hospital was doing shots. So I went to the Snoqualmie Valley Hospital homepage, and it had a big page about COVID shots and said, sorry, we don't have anything available. Don't bother us. Don't call. Go away.
Yeah.
That's weird.
So this is
And
what
then my wife gave me a link that she got from Facebook, and she set an appointment for me that seemed to work. So that's how I got my shot. It just seems almost totally random.
It's super difficult. And this is exactly what I went through with my parents. I was trying one supermarket and nothing for months. I tried another supermarket. I tried another pharmacy. Well, at least I got their name on a waiting list. I went to county health department and was doing this every day. And finally, a day popped up and it said, for 3 days, they had several appointments. So I got on there super fast. Got my dad an appointment because he's had health issues recently, done. And then I went to get my mom registered, gone, nothing. And most places are not scheduling out more than a few days. I mean, maybe now it's a couple of weeks because they didn't know how many doses they'd had. And how frustrating would it be to take an appointment, stop searching, and then have that appointment canceled, and then you're back at square one. So, fundamentally, the biggest problem right now is that the demand wildly exceeds supply. We've got 1.7 million people who fall into the current category, and we're getting 100,000 doses a week. Like, that's a huge problem. That is the biggest problem. And again, if we get AstraZeneca, if we get Johnson & Johnson, which is just a one-shot deal, so you don't even need to have a second dose, those will ease this process. But that's one of the reasons we need this COVID package too, is to get the funding to do that. And it's, at this point, the demand wildly exceeds supply, but in many months, we will be in the opposite situation where we have the supply, but we find vaccine hesitancy. And so I have a bill to address that because we got to start the process of education now. Who else?
How much of a problem is that in the state of Washington? I read it is a problem across the U.S., but like, how do we have some statistics about how many people are hesitant in the state of Washington?
We do not. At least I don't have those statistics. As a pediatrician, I can tell you that there are a lot of vaccine hesitant parents. I would say, ballpark 25% of my patients' parents had vaccine hesitancy, but there's only about 1%. Again, this is with typical childhood vaccines that have been around for a really long time. Only about 1% were flat out no. So the other, 24%, just a conversation with a trusted pediatrician was enough to bring them along. This one's different. It's a new vaccine. There's all kinds of political stuff that's getting in the way. A lot of the country still doesn't think it's a serious disease. There are a lot more issues. The fact that we had Operation Warp Speed, so people think that corners were cut, even though the scientific integrity on this was excellent. We see more resistance with this one, and social media is amplifying that, and partisanship is amplifying that. And we're also seeing more reluctance and resistance in some of the populations that are most at risk, the Black population and the Latino population. So these are things we've got to change if we're going to bend the curve on deaths. And it's also a reason, by the way, that I'm really pushing hard to get at-home, rapid, cheap testing for COVID, so that every one of you brush your teeth in the morning, swab your nose, see if you're COVID positive. If you are, because most people spreading this are asymptomatic, you just pull yourself out of circulation, because we need many tools. We need vaccines, we need at-home, cheap, rapid tests frankly, that the government just gets to you for free, I think. We need that in every home. Think about how safe our schools would be if every kiddo got a little nose swab every day, every other day, you know, then you essentially get COVID out of the schools. And if you wear masks on top of that, then you got a double safety check.
Do you see any lessons in this experience for the future? I mean, personally, I doubt that this is going to be the last virus that ever appears on the horizon. So what do you think we should be learning from all this?
There is a ton to learn. And in fact, that is a good part of what my subcommittee yesterday in Energy and Commerce was about. It was oversight of what has gone astray with our COVID response. And I'll tell you just a couple things right off the top. One, we just need a much more robust public health infrastructure in this country. We've got to fund it. We've got to have the people trained up for it. We've got to, I think, have help with people's educational funding so that they can go into public health. And they're not just going to be sitting there waiting around for the next pandemic. Think about all the things a good, solid public health structure could help with. It could help with vaccination programs. It could help with early childhood education. It could help with prenatal care and also with postnatal care, you know, with helping with parenting in those first months and years of life when a lot of parents need some support, and that gives kids the best shot for a healthy outcome. It could help with mental health, right? You could have a ton more mental health providers or classes, group therapy convened, and you could have much more robust help with drug addiction, the opioid epidemic. So a more robust public health infrastructure. We also, by the way, these rapid tests that I'm talking about, if we get that rolled out now, we figure out how to do the manufacturing at scale, well, then the next virus that comes along, bam, you know, you create a library, essentially a library of antibodies. You figure out which ones work best to detect that particular virus, slap them on a paper strip essentially, and get them out to everybody. Like you could snap scale up testing right at the start. I mean, one of the reasons South Korea did so much better at the beginning. Remember, we were doing hundreds of tests a day. They were doing 10,000 tests a day. Do you remember those days? Mm-hmm. It's because they had SARS and MERS. And so they were already snap ready to go at the beginning. They knew how to do drive-through testing. They knew, you know, that they didn't need a perfect test. They just needed a good test, because even if you missed some, it was better than flying blind. So these are the kinds of lessons that we're learning. And then the mRNA vaccines, wow. I mean, the fact that we can do that it's worked successfully now, that makes it much faster to get vaccines rolled out with future viruses. So there's some. Oh, can I mention one more thing?
Oh, sure.
The other really, really big thing is to never let politics come before science when you're dealing with scientific matters. I mean, like probably the biggest mistake that took place was that rather than having the CDC out in front every day doing the chat with the American people, that press conference should only have happened with public health, epidemiologists, and doctors. There never should have been a political person in that meeting.
I have a question. Related, it's kind of broader, and I'm not fully aware of your position on the issue of single payer healthcare or Medicaid for all or Medicare for all. But I'm CFO at Encompass Northwest, which is a pediatric clinic and early learning center. And one of our primary fundings in the clinic anyway, birth to 3, of course, is funded as a mandate, but over 3, we try to run a clinic. And because we take all comers, we get a lot of state insurance, which pays $30 on our $140 cost. So my question relates to how Congress is Congress cognizant of this issue where providers all of a sudden might be getting a lower cost, a lower price point on all of their services versus their costs? And what's being done? What's the thought process right now to mitigate that?
First of all, we're very aware. Before I even say that, I want to thank Encompass because you've taken care of so many of my patients with incredible results. And one of those patients was actually my son when we were working at his language development. It turned out we were just worried parents mostly, but anyway, we're very, very grateful on a personal level. Yes, we are very aware that the way that healthcare is funded now is crazy.
Yeah.
Medicaid reimbursement levels are horrifyingly low. Medicare is also too low. Private insurance then pays through the nose. That's why your premiums are through the nose in order to keep the system. And so one little thing that I've done is introduce a bill that at least increases Medicare reimbursement so that kids can have access to more healthcare providers. But it is one of the dangers in doing something like, a single payer health plan that unless you increase reimbursement rates, you can't get that done. It's also a huge logistical challenge. So what we're essentially working on now is shoring up the Affordable Care Act, bringing in a public option that I think should be Medicaid, but you would have to increase Medicaid reimbursement rates in order to make sure doctors' offices, Encompass, hospitals can actually stay open. And then this collection of bills also has one to cap premiums at no more than 8.5% of a family's income. So for the average family in the 8th district, that would drop their premiums from about $17,000 a year to $8,500. That's a really meaningful change that doesn't require upending the whole system. Thank you for the question.
Yeah, thanks.
Sorry, Rep Schreier, I know you have to get off the call here in a couple of moments, so maybe give you 90 seconds or whatever you have left for Wendy to get in any final comments as well.
I guess let me just thank you all for your work, for your service, for joining with me today. I'm excited to get some relief to our small businesses, to people, and excited to move forward with care, roll out vaccines better, more robustly. Thank you. I look forward to seeing you again.
Thank you.
Thank you.
Thank you.
Thank you for your time.
Thank
Appreciate
you
it.
very much.
Take good care. Bye.
Bye.
Thank you.
If I may, I just wanted to say
Thanks.
thank you also for having me here and to letting you know that our district office is right next door in Issaquah. And so if you or friends, colleagues, neighbors have any need of assistance with federal agencies, anything like that, you should feel free to reach out to us. And now you know me, so feel free to give me a call if you need. Thanks so
Thank-
much for all you do in Snoqualmie.
Thank you.
Thank you, Wendy.
Well, that was nice.
Yeah.